Hi, welcome to Netmixpedia. This is a short lecture review of ECG Basics. So the basic concepts related to ECG will be taught in this review. So let's move on. So the ECG leads, there are totally 10 leads and it will collect the ECG in a machine. So the waves will be recorded continuously by the electrocardiogram machine, and the recordings are P wave, QRS complex, T wave, and there will be PR interval, PR segment, QT interval and ST segment. So when we look at the conductive system of the heart continuously contracts and relaxes. So it will be, the relaxation will be represented as a flat line. When the SA node initiates the conduction, it will be depicted as a P wave in the electrocardiogram. So the P wave represents the atrial systole or the atrial contraction, when the blood will move from atrium to the ventricles. Then there will be a flat line. So during that time the electrical impulses will travel to the AV node. So this is represented as PR segment, and the AV node captures the electrical impulses, and these electrical impulses will travel through the bundle of His, bundle branches and Purkinje fibers, causing the ventricular contraction, which is denoted by the QRS complex in the ECG. So the QRS complex basically represents a ventricular systole or the ventricular depolarization, also called as a contraction of ventricles. So this QRS complex also hides the atrial diastole or the atrial repolarization within this complex. Later there will be a flat line in which the heart starts to relax, or the repolarization of heart initiates, and the repolarization of the ventricles is denoted by the T wave. So the T wave represents the ventricular repolarization, and the gap between the S wave and the beginning of the T wave is called as ST segment, and the beginning of Q wave to the end of T wave is called as QT interval. So that is how the conductive system of heart shows the electrical waves in the electrocardiogram. So this is a rapid review. So let's move on to the next section. So let's move on to the ECG basic concepts in-depth review. So here we will see the definition of ECG. ECG or EKG came from the German word electrocardiogram, is a transthoracic interpretation of the electrical activity of the heart over time, captured and externally recorded by skin electrodes. It is a non-invasive recording produced by an electrocardiographic device. So we have different waveforms and intervals. Basically we have a P wave, QRS wave and a T wave, and rarely we get a U wave. So there are some intervals like PR interval, ST interval, TP interval, RR interval and QT interval. Also there are some segments like PR segment, ST segment, and the ECG will be recorded at a speed of 25 mm per second. And regarding the ECG Grade, I will speak later on in this lecture. So we will move on to the waves. Initially we will see what is a P wave. So a P wave represents the depolarization of the atrial muscle Depolarization means the contraction of atrial muscle. So the voltage will be 2 to 3 millimeter in amplitude, and the duration will be less than 0.11 seconds, that is 2 to 2.5 small squares. That is the duration of P wave. So it represents the atrial contraction. So next we'll move on to the PR interval. So PR interval starts from the beginning of P wave till the beginning of the QRS complex. The duration is represented as PR interval. The duration is 0.12 to 0.2 seconds, that is 3 to 5 small squares. So time taken for the excitation to spread from the SA node through the atrium and AV node down the bundle of His to the ventricular muscles is represented by the PR interval. Next we'll move on to the QRS complex. So QRS complex represents the depolarization of the ventricles which has larger muscle mass. So the depolarization of ventricles, also known as ventricular contraction. So here the amplitude is as high as 25 millimeter and the duration with normal conduction is less than 0.12 seconds, that is 3 small squares. And there will be a J point. J point is where the S wave ends and the ST segment begins. So this point is represented or called as a J point. So next we'll move on to the ST segment. So ST segment is the time between completion of depolarization and onset of repolarization. So this is the time where the ventricles will contract and will begin the relaxation process. So normally isoelectric and gently blends into unslope of T wave. So this may not be seen as a flat wave. Sometimes from here itself we may get a slow movement of T wave. So point where ST takes off from QRS is called as J point and plays important role in diagnosis of ischemic heart disease. So this ST segment plays an important role in the diagnosis of ischemic heart disease. Next we will see the T wave. So T wave represents the repolarization of the ventricles or the relaxation of the ventricles. So tall tented T waves could represent hyperkalemia. So tall T waves represents hyperkalemia. T wave inversion can represent coronary ischemia, previous infarction or electrolyte abnormality such as hypokalemia. Next we'll see the QT interval. QT interval starts from the beginning of the Q wave and ends at the end of T wave. So beginning of QRS complex and the end of T wave is called as QT interval. So normal variations with heart rate and gender will be seen with the QT interval. So abnormalities like prolonged QT interval is common from drugs like procaine, quinidine or electrolyte imbalance. Next we'll see the U wave. It is a normal wave but still it is not quietly seen in every patient. So U wave is best seen in leads V2 and V3. The source of U wave is unknown. So it may be a normal U wave or it may be an abnormal U wave. So the sources according to the theories may be delayed repolarization of the Purkinje fibers or prolonged repolarization of the mid-myocardial M cells or the muscle cells and after potentials resulting from mechanical forces in the ventricular wall are the cause, according to the theories, are the cause for the U wave. Next one will look at the Einthoven's triangle. So this triangle, which gives us the lead 1, lead 2 and lead 3, are given to us by Sir William Einthoven. So we'll move on to the Einthoven's triangle. So here a triangle, imaginary triangle, is drawn from the right arm to the left arm and the left leg. So there will be 3 bipolar limb leads. The lead 1 from the right arm to the left arm, lead 2 from the right arm to the left leg, and lead 3 from the left arm to the left leg. So the positive electrode is always towards the heart. So that towards the heart there will be a positive electrode. So left foot is always positive and right arm is always negative. So the waves will be seen as this. So in depth, lead 1, the right arm will be negative and left arm will be positive pole. This lead is called as lead 1. And in lead 2, it is from the right arm to the left leg. It's called as lead 2. Lead 3 is from the left arm to the left leg. Then there are some leads such as augmented leads or augmented unipolar leads or augmented limb leads. So augmented lead of foot, AVF, is from the heart to the left leg. So AVL is from the heart to the left hand, and AVR, augmented lead of right, is from the heart to the right hand. So these are seen in the ECG as AVR, AVL and AVF. So these are 3 augmented unipolar limb leads. Then we have the chest leads. We have 6 chest leads, and the placement is the chest lead 1 will be placed in the right sternal border in 4th intercostal space. Second V2 is placed in the left sternal border in 4th intercostal space. Then we have third chest lead is placed in the midway between the V2 and V4, and the V4 is placed in the mid-clavicular line, and V5 is placed in the anterior axillary line in the 5th intercostal space, and V6 is placed in the 5th intercostal space at the mid-axillary line. So we have 6 chest leads. So the chest leads, what is the importance of these unipolar chest leads? So the chest leads V1 and V2 represents the anteroseptal portion of the heart, whereas V3 and V4 represents the apical portion of the heart, that is anteroapical portion, and V5 and V6 represents the anterolateral portion of the heart. So we will get V1 to V6 leads in the 12-lead ECG. So here you can see the anterior view is given by V1 and V2, the apical view by V3 and V4, and the lateral view by the V5 and V6. So the region of the left ventricle represented in ECG, the V1 and V2 represents the septal region in the ECG. V3 and V4 represents anterior region. V5 and V6 represents lateral region. V1 to V4 represents anteroseptal portion of the ventricles. V3 and V6 represents anterolateral portion. Lead 1 and AVL represents high lateral portion. Lead 1, lead 3 and AVF represents the inferior portion. So in the diagnosis of MI and some other cardiac problems, we use these leads according to the region of the heart infected. So let's see what is a ECG grade. So left to right time and duration is represented, and vertically it represents the voltage in amplitude expressed in millimeter. So in a ECG we may see the straight lines like this. Okay, so each straight line represents 1 second. That comes after 5 big squares. Okay, so the one big square is of 0.2 seconds. So 5 big square stands or represents 1 second, and one big square is again divided into 5 small squares horizontally as well as vertically. Okay, so the small squares, the horizontal small square represents 0.04 second. So the 5 small square represents 0.2 second, and one small square vertically represents 1 millimeter amplitude. So one big square represents 5 mm of amplitude. Okay, so how to determine the heart rate using a ECG? So the more accurate method only works with the regular rhythms. Okay, because irregular rhythms we get a RR interval which is very hard to determine and which is varied. So we do a calculation by looking at the ECG. The small squares coming in between the RR intervals are calculated, and it is divided by a number, that is 1500 divided by the number of small squares between RR interval gives us the rate, or 300 divided by number of big squares gives us the RR heart rate. Okay, so the 1500 is the number of small squares which comes in 1 minute, or the 300 is the number of big squares comes in 1 minute. So let's move on and let's do it practically. So let's see what is the heart rate here. We have a R interval and an R interval. Okay, so we have to calculate the number of small squares. So we have 1, 5, 10, 15, 20, 25, 26, 27, 28 and 1, 29 and 30. So we have 30 small squares, that is 1500 divided by 30 is equal to 50 beats per minute. Also we can calculate the big squares like 1, 2, 3, 4, 5, and here we have 3, 4 and 5. So we have total 6 big squares. So we have to divide 300 divided by 6 is equal to again 50. So let's move on another task here. So here we have 1, 2, 3 big squares and there are some small squares. So I calculate the small square, it will be easy for us. So 1, 2, 3, 8, then 13, 18 and 19 or 20 I can say. So 1500 divided by 20 is equal to 75. That is the heart rate in this case. So let's see what is the characteristics of normal sinus rhythm. So heart rate will be between 60 to 100 in case of normal sinus rhythm, and it is initiated by the SA node. Upright P wave before QRS complex is always seen in case of normal sinus rhythm. Upright P wave before QRS complex, and impulse travels to the atrioventricular node in 0.12 to 0.2 seconds, the PR interval, and ventricles depolarize in 0.12 second or less. Each impulse occurs regularly and evenly spaced. So that is a characteristic of normal sinus rhythm. So as you can see, all the RR intervals looks equidistant from each other. So in case of sinus bradycardia, again the RR intervals looks equidistanced, but there will be a bigger gap between the end of T wave and the beginning of the P wave. So appears like normal sinus rhythm, except that the rate is lower than 60 beats per minute, and it's common with the athletes. So it is not an abnormal rhythm, but it is a sinus rhythm with a slower heart rate. Then we have a sinus rhythm with a faster heart rate, which is called as sinus tachycardia. So the normal sinus rhythm, except that the rate is faster than 100 beats per minute. So here again the RR intervals looks like equidistant from each other, but the space between the end of T wave and the beginning of P wave is very small. Okay, so it is a faster wave than normal sinus rhythm. Then we have a sinus arrhythmia. So here the RR waves are not equidistanced from each other. So there is a smaller gap and there is a bigger gap. So it is like a normal sinus rhythm with intermittent bradycardia. Okay, we can say it like that. So similar to normal sinus rhythm, except that the rate is irregular, relatively common in young, and is often asymptomatic. This kind of rhythm, usually the people will be asymptomatic. So that is how we seen in-depth review of the ECG concepts, and if you are interested, you can watch my another video where I will deal with the advanced concepts of ECG, in which how to read different ECG waves of abnormal patterns will be dealt in detail. So thank you for watching my video. Thank you.